Hi, I'm Larry Ahrens. We're with Dr. Harvey White, who is Executive Director and founder of Vessel Health here in Albuquerque, New Mexico. And we've been talking about the vein system.
Yep.
Want to talk a little bit more about treating veins and once you identify some potential problems, talk a little bit about how you map out a treatment plan once you discover maybe
in the old days, Larry, we always talked about vein stripping. That was a operative procedure
that sounds
in the
bad.
hospital. It is something you don't want to have done.
Okay.
And it's rarely done anymore, so that's a fortunate thing.
Okay,
but
good news.
I talked a little bit about the spectrum of problems that vein issues can create, okay?
Sure.
From cosmetic to frank ulcers, all right?
Right.
Well, to begin with, there are a spectrum of treatments, okay? The treatments range from simple support of the leg, which we do with compression or support hose to try to create pressure on the outside of the vein so that they don't stretch and swell, to the use of some herbal therapies. And there are not many vein doctors, you might say, that offer some herbal remedies, but we do in the form of a compound called horse chestnut. It's been around for ages. Another called butcher's broom. These compounds tend to create a little more tonicity or contraction of the veins and can limit varicose veins. But beyond that, what we tend to do is a procedure that's called a closure procedure. And you know, I've used this little chart before, and I talked about this problem of an incompetent valve up here, all right? And it creates undue pressure down this vein in the leg. Well, when that's the case, what we often do is try to actually close this vein so it's no longer working, because the deep vein does all the work. And to do that, we do a procedure in the office. It takes about 1 hour. It's better than going to the dentist, I can tell you.
Okay.
In which we basically enter this vein with a small intravenous catheter. And what I will show you in a moment is put another catheter up to this spot here and heat the vein to close it. So I brought one of those, Larry, if you'll let me show you.
This is a vein catheter, right?
Yes, it is. And there are two types. One type is a so-called laser catheter, and we use a different type which emits microwaves, just like the microwave oven in your house.
Oh, so that heats the vein.
That does. And this is the element here that does the heating of the vein. And we thread this up to the groin or near the crease in the leg using just a gentle touch and our ultrasound machine.
Right.
And then we apply a certain type of electricity to this after the leg has been slightly numbed. And we numb that with mostly just with fluid, actually. We put it insulates the vein. And then in a stepwise fashion, this catheter is pulled back through the course of the vein that we wish to close. And it heats the vein to about 120 degrees Celsius, or overboiling. Okay,
really?
Yeah, overboiling. And the tissues of the vein basically shrink wrap, or they collapse.
I see.
And they do that gradually over the course of a week. We do this procedure in the office, as I mentioned, in a stepwise fashion. And you know, I'd actually invite you sometime. We could go to the office, and I could show you maybe a procedure while we're doing it. And we walk this back in a stepwise fashion, take it out, then we wrap the leg from up near the groin down to the toes. Okay, we wrap it in a little kind of a compression bandage, send an individual home. We bring them back in 3 days, remap it, and show or display that that vein has closed off. And that limits, Larry, that pressure going down to the varicose veins and all the problems that they create down here.
Really interesting. Now, little pain involved in it? None at all, really, as you were telling me.
We offer to give an individual a little sedative. Many don't take it.
Right.
There's a little bit of fear, you know,
Sure.
the unknown. But overall, it's very well tolerated.
And it's a very safe procedure.
Yes, it is. It isn't the end-all and be-all. Okay, there are some ancillary procedures that are also done, and some of those ancillary procedures are also done if the problem is not with that valve.
Yeah.
Those two procedures, Larry, involve one we call a phlebectomy. And I mentioned that this vein courses down here to the lower
Right.
leg down here. Occasionally, the varicosities or little dilatations don't totally go away with this particular procedure, in which case we make a couple of tiny nicks in the skin and actually take pieces of the vein out. Or in some instances, if necessary, we can inject the vein with like a detergent that will actually cause it to chemically close. And we also use that in patients that might have small cosmetic problems like spider veins.
Obviously, a lot of individual applications to this, and everything depends on your own personal health and your own case with your veins. But Dr. White can talk to you about that individually in the office at Vessel Health, because that's what you do.
And we invite anyone to call or visit our website. And once again, as I mentioned before, Larry, we're so interested in people's long-term health.
Yeah.
We talk a little bit about veins, we talk a little bit about arteries, but really what we want to get people into are good nutritional habits, exercise, emotional space that really permits them to thrive, you might say. And so we always turn to that with every patient, making sure their cholesterol is good, et cetera, et cetera. So we can be reached, though, at www.vesselnm.com or at 828-3000, area code 505.
Thank you, Dr. White.
You bet.